All right. Hey ho, let's go. This is Resistance Radio, where natural selection selects resistance and public health tries very hard not to select your salad. Today we are talking about Cyclospora, the microscopic parasite quietly turning summer produce into a nationwide experiment in risk tolerance. As of mid-July 2026, the CDC has 1,645 confirmed domestic cases that have been on the books since May 1st and is aware of more than 5,100 additional reports that are still being sorted out across at least 34 states. Think of it this way: if a typical year is a mid sized town of about 2,700 people getting sick, we are already up to a small city, and the census takers are still counting. So, where are we actually right now? So, in Michigan, that is currently the epicenter with over 3,300 reported cases and dozens hospitalized, making it the hardest hit state in the country so far. Ohio, New York, Kentucky, West Virginia, and more than 30 states in total are reporting infections, with one multi state cluster of at least 400 cases likely linked to a shared source. And if you imagine the US as a map of porch lights, this one isn't just a neat little cluster, it's a constellation with one especially light bulb over the state of Michigan. Public health officials think multiple outbreaks are occurring at once, not one single smoking salad bowl, and that there are some clusters, especially in Michigan, Ohio, Kentucky, West Virginia. These are probably tied together while many others are not. So if it feels confusing, that's because it is. There just isn't one story here, there's a whole short story collection. So, what we know and don't know about the source. Here's the part that everybody wants to hear. This is what the phone calls and text messages I get regularly, which is just tell me what not to eat. And the honest answer is we can't yet say so, not precisely. We do have some strong hints, what we refer to as signals in the epidemiological world. Okay, so after more than 1,000 patient interviews, Michigan officials keep hearing the same thing: lettuce and salad greens show up again and again and again. That doesn't mean all lettuce everywhere is poison, but it does mean that the Venn diagram of lettuce and illness has a concerning overlap right now. Historically, Cyclospora in North America has been linked to things like bagged salads, fresh herbs like cilantro, basil, raspberries, snow peas, and green onions. So the pattern, fresh, often imported, minimally processed produce, is frustratingly similar. What we do not have is a name brand, a name farm, or a specific field. The FDA is still doing traceback on multiple produce items, including lettuce, while acknowledging the produce supply moves fast and is highly distributable. Okay, now by the time the system can confidently say this was the product, it's very possible the batch is already moved off the shelves and sadly halfway through your GI tract. Okay, so let's talk about things that you can actually do short of swearing off fresh foods and vegetables. Right now, given the evidence in history, the highest risk category looks like pre-washed bagged lettuce and salad kits, ready to eat salads from restaurants and fast food, and raw leafy greens that you can't control from sink to plate. Michigan has gone as far as publicly advising residents to avoid bagged lettuce and pre-mixed salad kits for now and to buy whole heads instead. Their playbook is buy a whole head, strip off the outer 2 or 3 layers, and wash the remaining inner leaves thoroughly under running water. Think of it like peeling off outer pages of a newspaper that just fell into a puddle. You're trying to get rid of the surfaces most likely to have seen that contaminated water or soil. Safer bets in the current moment include produce you can peel, like oranges, bananas, and cucumbers with the peel removed. Any vegetables you can cook to a good hot temperature, like 158 degrees Fahrenheit or so, the point at which Cyclospora is reliable inactivated. And lastly, frozen produce from well before this outbreak window. This wave appears to have started in the late spring, early summer of 2026. Is washing enough? Not reliably. Washing under running water can reduce contamination and is still recommended, but both CDC and Michigan emphasize that washing alone may not fully remove Cyclospora. The parasite can cling to the outer surfaces and nestle into tiny crevices. So, vinegar rinses, lemon juice, and miracle wash hacks on social media are, to put it politely, aspirational. The move here is not avoid all produce. It's rebalance your personal risk budget toward peelable and cookable for a bit, especially if you're pregnant, older, or immunocompromised, or simply cannot afford weeks of on again, off again diarrhea. How to think about the numbers. Okay, so let's make this scale concrete. The CDC's usual annual tally is about 2,700 cyclosporosis cases nationwide, mostly in warm months. As of mid July, they already have 1,644 confirmed cases that are domestic since May 1st, plus more than 5,100 additional reports needing confirmation. Imagine a stadium with 7,000 seats. The CDC currently has one section fully confirmed and the rest with people who are still filing in and being counted. Michigan alone reports for more than 3,300 cases, 44 hospitalizations, which is like an entire small college campus worth of people getting the same parasite in one state. Meanwhile, no deaths have been reported so far, which matters. This is high misery, low mortality event. Also important is that there's a lag. The CDC estimates roughly 6 weeks between someone gets sick and when that case fully lands in federal data, meaning the curve we see on paper is the ghost of transmission past. If you're waiting for perfect real-time data, you are already behind. So what is Cyclospora? How does it behave? It is a microscopic parasite that infects the small intestine and spreads via the fecal oral route, usually through food, water, that is contaminated with human feces. But here's the twist: when it leaves the body, it's not immediately infectious. It has to mature in the environment for roughly a week or so before it can make someone sick. This means direct person to person spread through home bathroom situation is not the main driver. The problem is contaminated fields and water systems, not your cousin's bad hand hygiene. Clinically, this is a parasite of explosive watery diarrhea, bloating, cramping, fatigue, and sometimes weight loss. The hallmark is duration and relapsing symptoms. Norovirus is like a very unpleasant weekend. Cyclospora is like a bad roommate who moves in for a month and keeps forgetting to move out. Crucially, cyclospora is treatable. Bactrim, or what's known as trimethoprim sulfamethoxazole, for 7 to 10 days is the standard for immunocompetent patients, with longer courses for some immunocompromised. But there are two catches. Routine stool tests may not automatically check for cyclospora. It often requires a specific order or PCR panel. And if you never seek care, you never get counted, and public health never gets your piece of the puzzle. Okay, so every person who gets tested is not just a patient, they are a data point that can also help close this outbreak. So please get seen if you're able to, and get labs. So who needs to worry most and what to watch for? So who would be or who should be on higher alert right now? Anyone in heavily affected states like Michigan, Northwest Ohio, where case counts are clearly above baseline. People who've eaten a lot of leafy greens or bagged salads in the past couple of weeks. Individuals with prolonged watery diarrhea lasting more than a few days, especially if it comes and goes or has been ongoing for a week or more. Red flags that should be pushing you toward testing is diarrhea lasting longer than 3 or 4 days, especially with fatigue and weight loss, symptoms that improve, then relapse, and no recent international travel, yet classic symptoms during this current outbreak window. The CDC's own advisory explicitly urges clinicians to consider cyclospora during May through August, even without international travel, request specific cyclospora testing, and treat confirmed cases with Bactrim. Translation: if your clinician is still thinking this is a stomach bug at day 10, it is completely appropriate to bring up cyclospora by name. So why the response feels slow, and why it kind of is. Public health professionals are openly frustrated, and that tells you something. The CDC only just issued a formal health alert network advisory in mid-July, despite cases starting in May. Even seasoned experts have called that delay terribly unfortunate. In That terribly unfortunate, by the way, in epidemiologic terms, is very, very like, oh, that is that is basically they're saying bad, right? You should have done something a lot earlier. But in public health world, we couch our terms. So terribly unfortunate is the closest to say, wow, that was a real drop. Okay. Anyway, at the same time, parasitic diseases outbreaks are being handled by different branch than the usual foodborne bacteria team. And some experts agree that the unit has less experience with large multi-state foodborne investigations. And on top of all that, the broader system has been quietly hollowed out. The CDC's FoodNet surveillance network recently scaled back the pathogens it actively tracks, and state and local health departments are juggling not just Cyclospora, but record measles, pertussis, and various travel related threats. So, yes, there are highly competent people working incredibly hard. And also, yes, they're doing it with fewer staff, fewer tools, and an administration that previously deprioritized routine tracking of Cyclospora. So if this feels like a stress test of our capacity to manage multiple overlapping threats while under resourced, well, that's because it is. So how likely will this be winding down, or when will this likely be winding down? Most cyclospore seasons in the US wind down by late summer, typically around September, as environmental conditions become less favorable for the parasite to mature in a field. Add to that a short shelf life of fresh produce, often just a few weeks, and you get a plausible scenario where the specific contaminated batches are gone before we even reconstruct the story. CDC expects reports to be climbing through August because of that reporting lag, which means numbers will look worse on paper, even as the underlying transmission may be flattening. Think of it as looking at a light from a distant star. By the time we see it, the event has already happened. For now, the expectation from federal officials is that more clusters and subclusters will surface before the year is over, and some outbreaks may never get definitively linked to a named food. That is unsatisfying, but it is honest. The bigger story, however, is beneath all the salad anxiety is really a story about infrastructure, about how brittle our food safety net has become when surveillance is cut, lab capacity is limited, and public messaging is slow, about how long these incubation periods and complex supply chains strain systems built for faster, more straightforward bugs, and also about how easily this happens all the time, can slide into gaslighting when people are actually living through the worst season on record. So, if you're listening to the show, you're probably the kind of person who doesn't need to be told, don't panic. You want what's happening, how big is it, and what can I do that's proportionate to the risk. So, here are the short version. Yes, this is a large, messy, multi state outbreak. No, we don't have a single clean villain yet, but leafy greens, especially bagged salads, are under heavy suspicion. The most pragmatic move right now is dial back on bagged salads, lean into peelable, cookable produce, be attentive to prolonged diarrhea, and advocate for specific testing if you're sick. And remember, every time you answer the health department's call about what did you eat 2 weeks ago, you're not just reliving a boring grocery list. You're helping to build the map that helps us get us out of this. So, thank you for listening. This is Resistance Radio, where we read the footnotes, respect the microbes, and remind you that in 2026, the riskiest part of some meals isn't the spicy sauce, it can be the lettuce. So stay sharp, stay kind, and as always, stay resistant.